very much for joining us today. It's wonderful to see you all. We are going to get started in just 2 minutes, just giving people time to log on, but we're really nearly ready to start. Thanks for your patience. We're just waiting for one more speaker and then we'll get started. Okay, hi everyone, welcome. Thanks so much to all of you for joining us today. Just as we wait for one last speaker, I'd just like to go over a few sort of webinar housekeeping items. So just to let you all know that as participants, your audio and video are disabled. So don't worry, if you accidentally speak, we won't hear you during the webinar. So don't worry about that, you're automatically muted. It just helps with the large number of participants. You are able though to post questions using the Q&A function at the bottom of your screen, and we really encourage you to do that. So please do send any questions about the presentations or about your wider advocacy work. Please do share those with us and we'll make sure we have time for questions and answers at the end with the panelists. Also, just a reminder that the session is being recorded and that will be available on the INEE website. So please do share that with your colleagues and that will be available very soon. We also just want to let you know that closed captioning is available in English, and again you can see that at the bottom of your screen, that closed captioning is an option there. Just to let you know as well that the presentations as well as the recording will be shared on our website. So I think that's all the housekeeping for today. I think Dean is having difficulty joining us for now, but let's get, oh Dean, I think in the perfect timing. Can you hear me, Dean? No, that's okay, no problem. Let's get started and Dean will be with us shortly. So if we could go to the next slide, Hannah. Thank you. So the webinar today is advocating for education in emergencies during COVID-19. This is part of an INEE webinar series that we are doing at the moment, focused on education in emergencies during the COVID-19 response. There have been several webinars already. They're available on the INEE website, the recordings, and advocacy has featured on some of those. We had some passionate advocates on our inclusive education webinar yesterday and on our teacher focus webinar last week, so do take a look at those. We're really conscious that everybody is working tirelessly at the moment to continue education provision in incredibly complex and uncertain times, so we're really grateful to all of you for your work and also for joining us today. The webinars are really just to create a space for us all to come together at this time to share practical recommendations and examples with each other, and we're really happy to be able to focus on advocacy today, as we know it's such an important area of work for so many of you at this time. Before we get started, I'm just going to hand over to Dean, who's on the line now, just for more of a formal welcome to the webinar. Thank you, Dean.
Hi, good morning and good afternoon, even good evening for some of you. Just to start us off and highlight that, you know, influencing and advocacy efforts are more important now than ever if we're going to ensure the safety, the quality, the inclusivity of learning for all of the children around and youth around the world. And really, this is a time for us to also begin focusing on the education systems as schools to prepare, and we're hearing about some of the schools opening in some countries, and this is a real chance to strengthen ministries and support them in their efforts. And I just wanted to also emphasize the importance of the INEE minimum standards in really guiding this work. As you've probably seen, there's now a technical note released by INEE, and also really wanted to emphasize the advocacy pages on the INEE website. I know our advocacy working group has been working tirelessly to make sure those are up to date and available for all of you. And just very excited that this is going forward. Thank you so much for taking time out of really busy schedules to join us today. Thank you. Charlotte, handing back to you.
Thank you, Dean. And Hannah, if we go to the next slide, just to give everyone a sense of the agenda today. So starting with the welcome and introductions, and then we've got a great combination of presentations for you all today. So we have, we're going to begin with global collective advocacy efforts, exploring an interagency briefing and a civil society statement, which are all available for you. We're then going to look at 3 country contexts and advocacy efforts underway. So we'll hear from the cluster efforts in Nigeria, some joint civil society work in Uganda, and advocacy efforts in Honduras. And I'm noticing a typo on the agenda here, but we'll also hear from our colleagues at the Global Campaign for Education about work underway at this time. So apologies for the typo, but a great range of speakers today. And then we will have some time for moderated discussion, so please do submit your questions there. And if we just go to the next slide, just to show you the speakers we have today. So we're going to be hearing very shortly from Edmund Page, who chairs our advocacy working group. We're very grateful that Emma Wagner is here from Save the Children, Gustavo Payan from DAI, Mr. Mani Passi from the cluster in Nigeria, and Mr. Badar Musa from the cluster in Nigeria also. We'll also be hearing from Rachel Corbishley, leading the Education Consortium in Uganda, and from Vernon Munoz in the Global Campaign for Education. Apologies for my pronunciations, everyone. So huge thanks to our speakers as well for joining us today. I'm going to hand over to begin to the chair of our advocacy working group here at INEE, Edmund, just to give us a brief introduction before we get into the presentations. Thank you, Edmund.
Thank you very much, Charlotte. My name's Edmund Page. The organization I'm from is Xavier Project, but I'm one of the co-chairs of the Advocacy Working Group. The Advocacy Working Group is one of 3 working groups within the Interagency Network for Education in Emergencies, alongside the Standards and Practice Working Group and the Education Policy Working Group. Our role is to advocate on all aspects of education and emergencies, but from time to time we will have a different focus. For example, we were quite involved in the lead up to the Global Refugee Forum, as well as at the forum and from things that have come out of the Global Refugee Forum. But for now, as you can imagine, and like for many others, our focus has entirely shifted towards the COVID-19 crisis. We have been involved in developing the advocacy brief, which has been disseminated and will be discussed in the webinar today in some detail, as well as developing talking points for the website, which will be more easily navigable with drop downs to get around talking points and advocacy that might be relevant for you. As the Advocacy Working Group, we have also been working on capacity strengthening for in advocacy for the 15,000 plus members of INEE, as well as even beyond, not least through a series of 5 webinars on advocacy, which are also on the website. So in a way, this webinar is a good follow-on from that. So that's a bit of an introduction to our work at the Advocacy Working Group, and I'm going to hand straight over now to Emma Wagner for her presentation. Thank you.
Hi everyone, my name is Emma Wagner and I'm the Senior Education Policy and Advocacy Advisor at Save the Children, based in the UK. And I'm going to be presenting on 2 parts, 2 examples of global collective action advocacy that we've been doing on education emergencies and COVID collectively with many other organisations. First, I just wanted to say something about working together collectively for advocacy. So these are the 2 examples I'm giving today. We're going to hear about specific country examples later on. But I think there's something really important to say around working collectively in our advocacy, and that's something we do very much in the INEE Advocacy Working Group, is that when we can speak together, when we can have lots of organisations speaking together, it really helps our advocacy. It adds more weight. It sometimes is more credible if we're all speaking to one particular advocacy target, like a government or a UN agency or another partner, if we can all speak with one voice. And so the work that I'm going to speak to now refers to some of that work. And so, well, yeah, I'll kick off. So that's what you've got at the moment. Slide 1 is the interagency briefing that the INEE Advocacy Working Group and others worked on most recently and published. So the objective of this briefing was to ensure that education was seen as a critical part of the response by a wide variety of partners, governments, private sector, and so on. And what we had noticed was that there was a lot of different kinds of advocacy messaging being published by different agencies, but we really thought that having one document which has some really clear messaging and recommendations for a wide variety of stakeholders would really help to build consensus within the sector, show that we're speaking with one voice. And the idea is that the key messages and recommendations in this document help to ensure that there's safe, quality and inclusive learning opportunities reaches all children during the COVID crisis, and the education systems are strengthened, ready for the return to school. So that was kind of the overarching objective of it. But the idea, the format of the briefing itself was that it would be able to be used by a lot of different stakeholders for their different contexts. So although the messages are global, we hope that they can be tailored by different partners in different countries and regions. So you can either use the briefing as a product, as a standalone, but also you could draw from different parts of the briefing for use in your market. We also wanted to make sure it was easy to work with, not too long, and that the structure was simple. And the initial idea for this briefing actually came about through a similar one that was done around the Ebola crisis around 2016 in West Africa, where the same kind of partners came together to produce a briefing around safe school opening. So that was the original purpose of the briefing. So overall, it's about 10 pages long. There's some overarching key messages in the opening part of the briefing, which talk about the scale of the crisis on children's learning and well-being. That this is a crisis that is global. It's affecting every country, although some will be more prepared than others to respond to it. The message that SDG 4 was in more jeopardy than ever before, but also that education has a really important role during this crisis in keeping children safe, ensuring that they can continue to learn, and also the challenge around equity, recognizing that many children and youth will have different abilities to access technology or learning materials, depending on where they live and what their circumstances are. And the overall call to action of this briefing was that governments and donors, in collaboration with national and international partners, must urgently ensure safe, inclusive access to emergency distance learning with psychosocial support and social emotional learning components during and after the COVID-19 response. And in the main body of the briefing, there's a series of different sections with recommendations, of some of which you can see on your slide. You can see there's the headlines of the recommendations are on this slide now, but in the briefing itself, there are background to those recommendations in more detail. But they touch on distance learning, well-being, addressing the needs of the most marginalized children and youth, including girls and children with disabilities, and those affected by conflict and displacement. Obviously, recognizing that teachers play such an important role during this time, as always, and that they need additional support to be able to continue to reach out to children who are learning at home. And also recognizing that parents, obviously, really critical to children's learning, particularly at this time when children are at home and parents may be feeling stressed, may not be able to continue to work themselves and will be having to manage childcare as well as potentially helping with homeschooling. So there's some messaging and recommendations about that too. And then there's recommendations about education systems being ready to prepare for safe opening. And lastly, that financing obviously needs to underpin all of these different recommendations and messages. And so there's some particular messaging around financing. And then the last section really tries to make the case that learning is still possible when schools are closed. I think we have heard from different contexts that some governments feel that because schools are closed, that no learning can happen during this time, and that's been very difficult to push out distance learning or alternative distance learning opportunities at this time. But we really want to show that this is still possible, particularly if coordination is taking place, coordinating with structures that already exist and strengthening them, particularly the education cluster, UNHCR, education emergencies working groups, and so on. And lastly, that we really want to ensure that children and youth are part of this, that they are feeding into the education response plans that are happening right now, that are developing and being implemented, so that we can actually hear from children themselves about the needs and experiences of their learning right now, so that it can inform planning. And so that was kind of an overview of the briefing. I wanted to say a little bit about how we distributed that. So it was signed on to by a number of different organisations. And with Save the Children, where I work, we distributed this briefing to donor governments and ministries of education throughout our movement. We have advocacy colleagues who are based in different country offices who were able to then share this briefing directly with the relevant government contacts. We've also shared this out with multilateral donors such as Education Cannot Wait, the Global Partnership for Education and the World Bank, as well as with UN agencies. And we've shared it with the cluster so that all cluster coordinators can see this briefing and use it in their markets, their contexts. And we've also shared it widely across different civil society networks and constituencies as well. And of course, you can see the blog that's on INEE's website, and we've been doing a lot of social media about this briefing as well. So this briefing has been published for a couple of weeks now, and so it's difficult to say exactly the impact. But what we do know is that it's been used by a wide variety of organisations who've been able to kind of tailor the messaging and use it to give recommendations to ministries of education, donors, and so on. And we're going to hear some examples of how it's been used at the country level shortly, but I wanted to share two examples of how it's been used with donor governments. So in the UK, the Global Campaign for Education, which is called the Send My Friend to School campaign, has used the messaging in the briefing to develop their own specific briefing, which has been tailored towards the UK government, and that's just being finalised at the moment. And in Canada, Save the Children Canada, PAN Canada, and UNICEF Canada work together to send the briefing to officials at the government there, with a covering email explaining why they thought this briefing would be useful and suggesting that they have a meeting with the government to kind of outline some specific areas where the government could make a really important intervention on education globally. So I'd like to suggest to everybody on the call, if you haven't looked at the briefing already, please do take a look at it. I'm sure there's ways that you might be able to use it in your context. You can do that by either sharing it as a product, a standalone document that you can share with governments and partners, or you can pick and choose parts of messaging that you think are most useful and develop your own briefing or email to send out. But we really hope that it's been used very widely and look forward to hearing from others who are participating in this call about how they've used it. And I'm just going to go into the next slide now to go through my second example. So we obviously know that financing is always a challenge in education and emergencies. We know that 2 to 3% of humanitarian funding is dedicated to education emergencies, and it's been kind of stuck at that point for some time. And during this COVID response, financing is more important than ever. Obviously, we're all struggling to respond to the crisis. We need to reprogram, adapt our programs, and find alternative ways of continuing learning and supporting the well-being of children. And this all takes money. So, of course, as the INEE Advocacy Working Group, we advocate for more funding for education emergencies. But this specific example I wanted to tell you about today is actually from a different group. It's from the Education Cannot Wait civil society group, the Northern Civil Society Group. And if you want to know more about that group, you can contact me and you're welcome to join that group, that listserv. So you may know that Education Cannot Wait, the Global Fund for Education Emergencies, has responded really quickly to this crisis, and they've allocated $23 million from their first emergency reserve, which they've allocated to 26 countries through lots of different partners. And their funding is continuing learning, supporting wellbeing and scaling up WASH facilities and many other different kinds of areas. But they actually received applications worth a lot more than the 23 million that's been allocated. And so they know that there are significant other needs, funding needs. And also we recognise that this crisis is going to be unpredictable. We could see schools opening and closing again, depending on additional outbreaks that may occur. And so the financing for this crisis really needs to be quite flexible over the coming months. And so the Northern Civil Society Group for Education Cannot Wait, we're thinking about how best to support Education Cannot Wait with their advocacy, particularly around the funding needs that there are. And so the group came together and produced this civil society statement. And it was signed on to by 25 different organisations. And we're really grateful for Julia McPherson from JRS, Jesuit Refugee Service, who kindly did the first draft and was able to persuade 25 organisations in that group to sign on to it. And that's been now circulated to many different donors who are already part of Education Cannot Wait or who already fund it, but also to other donors who are yet to fund Education Cannot Wait and could see this as the first bit of investment that they want to put into Education Cannot Wait. And you can see on the slide that Education Cannot Wait was really grateful for this advocacy support. They've publicised it far and wide, including on their website. And since then, the UK government has allocated £5 million towards Education Cannot Wait. And this tweet is recognising that, and Marie Trevelyan is the Secretary of State for DFID, kind of recognising the support that they're showing. And so my ask for you all is to please look at this statement, do share it if you're in a donor, a government, if you are in a donor country and think that you could share this with your government contacts, please do. It'd be great to hear if you're already sharing it and if you've had any feedback from any contacts in government. And I'll finish there. Thank you very much.
Thanks so much, Emma. Really important work happening there, and grateful to you and all of the colleagues you've been working with in these sort of collective efforts, as you say. It's always important to be reminded about the power of that kind of collective voice. So thank you so much. And just a reminder that everyone can find the resources mentioned today in the COVID-19 collection on the INEE website. But without further ado, I'd like to turn now to some of these country efforts and the different advocacy happening. We're going to start by hearing from our cluster colleagues in Nigeria and the important work they've been doing. So over to you, Pasi and Bada, and we'll move on to your slides now, but look forward to hearing from you. Thank you.
Thank you. Good afternoon, colleagues, and good morning for those who are still morning there. Yes, I'm Pasi from Nigeria. I'm the Education Cluster Coordinator in Nigeria, based in Maiduguri, Borno State. I'm supposed to be with my colleague Bada. He's not able to join us today. So just to present you the context here, Nigeria is one of the big countries in Africa with 210 million people. So you can imagine now this COVID-19 has affected Nigeria for now. It's more than 46 million children who are affected in all the countries. And the crisis in Nigeria is in 3 states, Borno, Yobe, and Adamawa, with 4.2 million students in the, when we call by state, it means Borno, Adamawa, and Yobe states. These are the states where we have the crisis, or the level 3. So all the sectors or clusters are based in Borno. So in terms of advocacy, we want to share with you some action that we did, because and also challenge that we have faced during this period, and to address the COVID-19 crisis during this period. As you know, the most challenge problem that we have, it was within the humanitarian structure itself. Means when we have OCHA, when we are developing the addendum to HRP, you'll see how OCHA and the ISWG, the intersectorial working group, is presenting COVID-19 as the health-centered crisis. And we agree with that, it's a health-centered crisis, but also it has an impact on education system. And I think that this was the challenging problem for us, to bring actors, humanitarian actors, to understand how education has been impacted by this COVID-19 crisis. If you go in all Africa, we know between the 1st and the 10th cases of COVID-19 affected people, already all the government took the first decision to close the school. But unfortunately, they don't understand that this is affecting the system. So we had this fight among us with OCHA, with other organizations, with other sectors, to understand how they can bring and more consider education as one of the key programs to be considered during this COVID-19. So this was one of the challenges that we face, and we go through advocacy with OCHA at all levels, with the deputy humanitarian coordinator. We write even to the humanitarian coordinator. We try also to involve Save the Children and UNICEF as the lead agencies of education cluster to see how we can prioritize also education. So this was a long process, and some of the lessons learned, let us focus on contribution that we have put in the addendum of HRP. We involve also other sectors, because when we develop our response strategy on COVID-19, we work with other sectors like child protection, we work with CCCM, we work with WASH sector, WASH cluster, we worked also with health cluster. And in our response framework, we can see how the holistic approach, we are working with all these sectors. So even when we are working with OCHA, it's up to us to make OCHA to understand that education should be one of the key sector during the response. So that was one of the challenges. The second challenge also is funding, and we are talking about funding, but as we can know also, what we did here to make advocacy more easy to approach also donors on funding options, we didn't expect to get more funding during COVID-19. Education on field, we had new activities. It's different from other sectors like, I don't know, WASH. They have the same activity before COVID-19 and during COVID-19, it's the same activity, but they change the location. But for education, we were obliged to develop new activity like this radio, television, remote program. So it's new activities, and we approached donors. We had a meeting with some donors and asked them to be flexible on funding, because we have already mobilized more than 40% of the HRP funding that were targeted. So we tried to ask donors, can you be flexible and to allow a fund that is already approved to be reallocated on COVID-19 activities? So some of donors, they accept, like ECHO, and we really appreciate the effort of ECHO to agree that partners or implementers, they can resubmit other activity in terms of response to COVID-19. And also we get ECW funding, we get also GPE funding in Nigeria. So I think for now we are okay. Our budget for COVID-19 response is around $15 million, and we are about to get more than 8 million for by state and at national level. The third thing that I want to share with you as advocacy, it's also about, if you look when all the sectors, they try to develop their response, the context in Nigeria, we have IDP camps, and most of the camps, they are around school. We have also some school in our village. And people, they are trying to use school infrastructure or education facilities for other purpose, like to decongest the IDP center, to use schools as isolation center, or to use even school as market. So there are many other purposes they want to use school. And sometimes this puts children in danger when it will come to reopen the school. So the education cluster tried to develop with the Ministry of Education, we suggest to the Ministry of Education a guidance note saying, okay, the principle, we don't want people to use school as isolation center or healthcare centers. So this was the principle, but we know that there are exceptions. And we try to develop some criteria how they are going to do when they are using school as an isolation center. They have to inform who they should inform. They will have to work with who, what will be the process, how they can ensure that the school will be disinfected before the children to come back, and what will be all this process. So to develop it, we involve WASH sector, we involve CCCM, we involve also health sector and child protection. And the guidance note have been approved by the government last week, and we shared it with all the partners, and we shared it also with the global education cluster. So this is a good document that we have, and the most important thing it will be to monitor if the states or they're following it. And lastly, what I want to mention here, it's also the inclusion of Quranic school. The case here, it's in Nigeria, we have also a huge number of children who are going to this, they call it Sangaya or Islamia. It's kind of Quranic school that are not related directly to education ministry. They are under Ministry of Religion Affairs, but it's children. And most of them, they think that they are going to school. So we try to make an advocacy to see how our response during this period, the response of the Ministry of Education, can cover also these children who are attending the Quranic school. And we try to advocate with the Federal Ministry of Education. We go on the state level, and we agree that on the radio program and television program, we were able to insert also some programs, some lesson on Quran, to be sure that those children can also be part of it. We want to make this e-remote program as a bridge to help us to take this out of school children when we come back to school. We can see how we can link it, and those children can join a formal structure or formal education. So these are kind of advocacy that we went through to ensure that education was taken account during this response. And I'm going to finish with the next step that we have, just for 1 minute. We are planning, of course, to go with we are making an advocacy now, trying to develop a document that will help the states and the government in the process of reopening school. You know, we are already talking about to reopen school, but we want to see how can we do it in a safe manner? How can we do it and then children will not be exposed, as some schools have been used as isolation center or units, as some schools have been used as healthcare. So we want to see, we are still developing this document, and at the state level, then we bring it at the federal level to have a kind of program, a guide notes that will help for children to be sure that the reopening school will be safe, organized, and well planned for them. So this is what education cluster in Nigeria is trying to do with the government to ensure that advocacy education is well considered and prioritized during this COVID-19 response. Thank you.
Thank you so much. Such important work. We really appreciate it, you sharing those reflections. Thank you. And we're going to move quickly on because we're conscious of time for another example, this time from Uganda, some civil society advocacy work that's been happening there. So over to you, Rachel. Thanks for joining us today.
Thanks, Charlotte, and hi everyone. So my name is Rachel, and I'm talking to you from Uganda, and I manage a consortium of NGOs, so a number of different national and international organisations that all work on refugee and host community education programming. So just very briefly on context, Uganda is host to one of the largest number of refugees in the world, and due to COVID-19 mitigation, one of the very first things that the government did here was to close all education facilities, and that was over a month ago now. So that left 15 million children, including over 600,000 refugee children, out of school. The Ministry of Education very quickly moved to develop a preparedness and response plan, and the development of the plan was supported by UNICEF and NGOs. And I think the input to the development of the plan provided us with an entry point and access to influence the response right from the beginning. So I think it was really important that we were a seat at the table from the beginning of the planning discussions. So just to go over some of our civil society education advocacy efforts here, I think One thing to say is that it's been very different depending on the challenges that we faced and the level of the stage of the response that we've been in. As this is an entirely new context, it was not that we sat down at the beginning of the response and said, oh, here's our advocacy strategy, this is what we're going to do over the coming 6 weeks. Not at all. Instead, we've really had to see the direction that things move in. So I think building off both what Pasi and Emma were saying, our first priority, as is often the case, was funding. And here in Uganda, our priority wasn't even mobilizing additional resources, but was actually about protecting the funding that we already had for our consortium of NGOs. So it was really concerning for us when donors started to mention that resources could be reallocated from the education sector to support seemingly more life-saving sectors, particularly health, nutrition, WASH, food security. So the main priority that we had at the beginning was to make sure that that didn't happen. And so the Education Consortium and the NGOs through the Education Emergencies Working Group developed a briefing note. And the briefing note showed practical ways that education can still happen. So I think really similar to what Emma was saying, we put it into a Ugandan specific context and gave really tangible examples as to how learning can continue. And we really highlighted the protection risks associated with school closure. 17 agencies signed on to the briefing note, including international and national NGOs. It was shared with all in-country education donors. We've got an education development group. So the briefing note was shared with them, including DFID, USAID. And it was also shared with some donors in some key cities internationally, such as Brussels. The good news is that not only was the funding that we had already had committed was protected and earmarked, but we've also been able to fundraise some additional resources for scaling up an education response. So after we'd protected our funding, our next priority was actually implementation. One of the biggest challenges that we found here was very similar to Nigeria. Education was just not being considered at all. And so the government here has banned all vehicle movement, and essential services have been given permits to continue to move. And so we needed to make sure that we, as an education and protection sector, were considered amongst those critical services. The UN and the government produced various iterations of business continuity plans, and in the first drafts, education and child protection were entirely absent. The documents were not child friendly, they were not child focused, and there was no consideration of learning and protection. So the ways in which we overcame this was really through advocating through established UN systems and structures. So for the refugee response, country directors raised this directly to the head of UNHCR. And through the development sector and the national response, it was through the UN Resident Coordinator Office. And we mobilized as civil society to get our country directors to really get this on the radar and the attention. And every time a draft business continuity plan was shared, we just made sure that we were continuously providing those critical comments and inputs to make sure that education wasn't missed entirely. I think those national efforts were really critically coupled with the efforts of field teams on the ground. So here we've got district level task forces that are coordinating district level response activities. And our field teams were making sure that in every meeting, education was a standing agenda item. So they weren't just focusing on health and WASH, but they were also talking about education at district level. One tip that we found really helps is ensuring that you are integrating health and WASH and protection into your education response. So we found that using health as an entry point, so offering to support the health sector with key messages and child-friendly messages and information dissemination has enabled us the entry to have a seat at the table at the district task force meetings and then ensure that learning and protection are continued. So that's a useful piece of advice that we found has really worked with government officials at local level. Another priority that I hope many other people have been tackling as well is around making sure that the most vulnerable are being considered in the responses. And I think just to flag here, we've got some initial data from our response that over 80% of refugee households don't have any access to the radio. So the government are airing radio learning sessions and over 80% of refugee households can't access them. And so again, I think having that voice and that representation has been really important to make sure that our response isn't focused on tech-based solutions. The government response was initially entirely focused on TV and Colibri and computer-based programming, and we found that even low resource support like radios are still really exclusive. So the good news is that we've worked with the government to develop home learning packs, self-study packs, which are really basic homework sets essentially for all of primary and secondary grades, and those are now being distributed all over the country. Another thing I think that we've had to really keep bringing up again and again to make sure it isn't forgotten is the different needs of children with disabilities. And again, that radio and TV and computers are naturally really quite exclusive means of distance learning. And so making sure that in all of our budgets and plans that there's adapted and considered needs. And we've been working really closely with Humanity and Inclusion, who's a member of our consortium, to be ensuring that we're developing and considering adapted materials for children with disabilities. One other advocacy area that we prioritised very early on was teacher salaries, and we wanted to ensure that the welfare and well-being and livelihoods of our teachers was protected. And thankfully, we had no pushback on that from any donors. So we were concerned that there would be a perception of a budget saving exercise to say, well, schools are closed, so here you go, have all of this money from teacher salaries. So that was a key talking point that we've integrated into our briefing notes. And then finally, in terms of what's next, quite similar to PASI, we've seen that schools have been identified to be used as both quarantine centres and isolation units. And so we're looking to develop a briefing note with the government for how this can be, well, to ensure first of all that it's only done if it's a truly last case resort, and to advocate against the schools as isolation units. And then where it really must happen, and in some of our really low resource environments, schools are the only buildings and infrastructures that are available. So how can we do this in a way that's responsible? And I think a common challenge that we find is that the health and education sectors don't often sit down together. So we've been integrating with some of the leading health actors to try and get their technical input so that we can put together some practical guidance for both the Ministry of Health and the Ministry of Education to work together to develop those SOPs. We've also, with thanks from Education Cannot Wait's FER funding, we've also got plans to produce a Children's Voices piece. So Hear It From the Children report, where we'd like to use this experience to hear from children, what have been their experiences of lockdown, what have been their challenges, and how have they found it, and use that to really get children's voices out there and make sure that children's experiences can be heard. And you can see a picture of one of the girls that have received a home learning kit. So those are our plans for the next period. And yeah, the briefing note that I mentioned has been shared with INEE, so I think that will be made available. And yeah, I can see a couple of questions that I can respond to in the chat box.
Great, thanks so much, Rachel. And yeah, we'll make sure the resources are shared widely. So thank you for that, really practical examples. And again, thinking about collective action. So really appreciate that. And now another context to hear from Honduras and Gustavo. I'd like to invite you now. Hannah, we can stop the presentation and hear Gustavo's example. Thank you.
Thank you. Well, thank you for the invitation to present. My name is Gustavo Payan. I am the Deputy Chief of Party and Senior Technical Advisor of a project in Honduras that focuses on promoting safe learning environments. We receive funding from USAID primarily, but also from UNICEF. And I know I have just a few minutes, so I don't even have the slides. I'll share briefly our experience advocating with the Ministry of Education. A slightly different story to what we've heard so far, in that we're not an advocacy group or an advocacy project, but I sit with Emma and Edmund in the advocacy working group. So in INEE, so I've learned a couple of things from them. But we really have been more advocating for education emergencies approaches to be inserted in the government's response to the crisis. So a little bit of background. Our project has formally introduced concepts of social emotional learning and psychosocial support and well-being in the system in the last couple of years. It's been very successful in the field, in schools with teachers and students, given the conditions and challenges related to conflict and violence that they face. But it has gained moderate support at best at the high level in the Ministry of Education. They have allowed us to do our thing without really necessarily pushing strongly for these types of approaches. So when schools closed in mid-March, the first reaction from the Ministry of Education and donors and humanitarian organizations was to push academic content. And this relates to some of the questions that came up from Tika, I think. So basically academic content and trying to make up for the lack of, on-site schooling. But all the other aspects like meals that some of the schools provide, those were being prioritized as well. This we felt and we noticed caused put a lot of pressure on teachers, parents, students, because the conditions are not there, the programs were not ready, and there was a lot of expectation about delivering academic content without taking into account issues of well-being or psychosocial support. So those key aspects and looking at not only as separate things, but looking at using it as a lens through which education was being delivered was missing. So we started reaching out to the Ministry of Education. We have a relationship with them, but when we started talking about some of these challenges, and it resonated because there was a pushback from teachers. We started sharing some of the INEE tools, like the minimum standards. We talked to the Vice Minister of Education about the minimum standards of INEE. We shared and then the advocacy brief came out. We shared that, and or things like the PSS, NSEL technical note from INEE, and that really resonated. And finally, we got the attention that we were looking for. So the as a result of those series of conversations that took place very quickly, about a month ago maybe, we have now wide open entry level to the Vice Minister and pushing SEL and PSS content as we're trying to adapt some of the programs into distance learning format, be that, via WhatsApp or video, but also given a chance to put up our content at the level of the academic programs on TV and radio, and spots on well-being and mental health. So for us, that was a big win. But also importantly was the fact that we were tasked and agree with the Vice Minister, who's really leading all the technical efforts to respond to the emergency. We're tasked with co-developing the strategy for school reopening that will have these three different pillars of biosafety, academic, and learning, but also elevating psychosocial support and well-being at the same level. So we're working on that, and that's given us an opportunity to push and advocate for more resources from the government for issues of well-being and as a precursor to learning. So one note on Honduras is that there's no education cluster, and efforts tend to be quite fragmented. Even there's a working group of education donors where the Inter-American Development Bank or the World Bank, UNICEF, USAID, and others sit. And it was fascinating to me that minimum standards on education emergencies were not really well known. So we're lucky to have Dean actually give a presentation to them. And so just introducing education emergencies approaches that we know are important and key in the context of this emergency. So we hope that we see more resources allocated, and with the government, but also from other players in the world. So that's a little the story. Happy to help and share more of the experiences. I know we're short on time, so thank you.
Thank you, Gustavo. Really appreciate it. And it's been great, I think, to have this contrast of different contexts, common threads amongst them, but also different approaches needed. So really helpful for us all. Thank you. And last but not least, we're going to hand over to Werner at the Global Campaign for Education for some reflections on the work that GCE have been doing in different contexts. Thank you, Werner.
Thank you very much. Good day, greetings from Costa Rica. Thank you for the invitation. I'd just like to share some of the GCE positions on the COVID's impact on education, which also support the communication campaign that we started. So as Boaventura Sosa says, the pandemic don't kill us indiscriminately as it seems. So we know, for instance, that girls and young women and people with disabilities will be particularly affected, as well as migrants, informal workers, and the elderly. We know, for instance, as an example, that the helplines that attend the violence against women have doubled the record in the past 2 months during the COVID. So it's just an example to see how serious the situation is for specific people. So we all agree that the interventions responding to the outbreak should be equitable, gender transformative, and protective of human rights in general. So we think that governments should understand that education is not a human right in itself, an enabling right, but also it is part of a kind of social protection structure that includes the right to health, the right to information, labor, and comprehensive human safety. So we think that these rights cannot be just ensured in isolation. So for instance, in many of the Latin American countries, and that's the case also in some African and Asian countries, when you close a school, you also impede children to have the only meal they can have in a day. So in many regions, it is also true that in many regions, children are also learning with illiterate parents. So we think that comprehensive and coordinated responses are needed to address multiple people in multiple scenarios. So this is why there is an urgent need for action at both national and global levels to unlock resources, and only to ensure that these resources are directed to respond to the populations in need. So these immediate solutions should include debt relief and increasing the official development assistance, for instance. So in this context, GCE is developing this campaign, and we are calling for governments to obviously prioritize education in all emergency responses, which is the common goal for all of us. Yeah, we are also asking to ensure distance learning that is accessible for all learners. However, we should take into consideration that virtualization of education is not the case, considering that the digital gap is leaving behind most of the marginalized populations, and we are talking about millions of people. We agreed on keeping teachers as our most valued actor, covering their wages and their well-being, and obviously planning for the reopening of school. But we also think that this pandemic has showed that the prevailing economic model has not future. And it is obvious because we have seen that in countries with a highly privatized health systems are those who have shown less sensitivity to guarantee human rights. So we also think that we have a good opportunity to encourage, the political debate on the macroeconomics as well. Within the global campaign, we have several responses. I just need to quote some of the actions from the Asia Pacific. They are monitoring closely the government accountability and the international support that countries require in this moment. And in the Middle East, our coalitions are demanding the comprehensive reviews of the school programs and curriculum, so that they can adapt it to the new circumstances. Sorry if I have taken too much time. Thank you so much.
No, thank you so much, Benno. Yeah, wonderful to hear, and we'll be sure to share any resources via INEE. Everyone, I'm so conscious of time. I know we had planned a Q&A. Hopefully we've been able to respond to questions in the chat box, and we can follow up with questions as well. But we really wanted to give time to hear these varied examples to hopefully help with all of our advocacy efforts in different contexts. We do, however, we'd love to hear from you. We have a poll that we'd like to hear some reflections of you. The first question is really to hear what the major advocacy priorities are in your context. So if you could just, oh, has something gone wrong here? Sarah, I think maybe, oh no, is it underway?
It's worked.
Great. If we could just hear from you what your priorities are, you can select the answers there. And our advocacy working group here at INEE are going to use this information as they think about their work to support our network members. So it's really helpful for us. Just a few more seconds on that first question. Great, thanks, Sarah. And then our next question, so that we'll use this information, we'll share it with our advocacy working group here. The second question is, and third question are really around whether you're using these resources currently and what resources would help you in your work. And again, our advocacy working group will take this information back and think about the support that they can provide in future. So have you used the brief that Emma spoke about, and what other tools would you find helpful? Just a few more seconds. Great, thanks everybody. That's really helpful for our planning here at INEE. So as I said, I've seen quite a few questions in the chat that have been asking around distance learning strategies. We do have a recorded webinar around distance learning where some very practical examples were shared. So I would encourage you to look at that one. Similarly around inclusive education and teacher support at this time. And we will continue to share resources via the INEE COVID-19 collection and on our kind of webinars and blog series. We do have some more webinars coming up next week. We'll be having a webinar focused on gender and implications for COVID-19, and also we'll be doing the official launch, although it's already available, of our technical note to support colleagues during COVID-19 and with some reflections around the importance of the minimum standards. So we were grateful to hear about that today. I just want to thank our panelists for such a range of really practical and powerful presentations around advocacy efforts underway, to thank all of our attendees for joining us. I'm sorry we didn't have a chance for the discussion, but we will follow up with you on the questions that you raised. But just thank you again for all of your tireless efforts to support education in emergencies in these uncertain times. So thank you, everyone. Please stay safe and well, and we look forward to connecting with you by the INEE network. Thanks, everyone.